Happy Friday, everybody. Oh, no, happy Thursday, everybody, and welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, we're doing something different today. I don't know how it's gonna work, but we are gonna try it. We are gonna do a mini segment on taking more steps to lose weight. It's insanely effective. And then we're gonna do a complete live Q&A, Ask Me Anything, and it's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle, with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. Turn on your notifications. It helps us so much. I'm your host, plastic surgeon Dr. Bruce Hermann, and Sarah is not with me today. Sarah is actually on a business trip. Do you have Brenna in the box? Hi, Brenna. How are you today?
Can y'all hear me?
I can hear you. Yeah, you're doing good. How are you? We got Rob here who's helping me out. So we are actually doing something kind of interesting today. We are going to do a live stream Q&A, and we're bringing in TikTok because I got a lot of followers on TikTok, and I'm hoping that they're going to come in big when we do the Ask Me Anything Q&A. But before we do that, I do want to do a mini segment. So you guys know, Brenna, Rob, I just came off vacation, all right? Now here is the cool part. Now vacation was awesome. Had a great time. But there was actually something really interesting that happened when we were on vacation. We did a cruise, which historically, if you go on a cruise, you gain like 20 pounds. Have you guys been on cruises, Brennan, Rob? Yeah?
I've been, yes.
Yep.
Did you go like to get some plastic surgery? You went on a cruise?
No, I did not go to get plastic surgery.
Sorry, I had to do it.
I did not go to get plastic surgery, Rob. Thank you. No, we did a cruise, right? And when you go on a cruise, what they got, like all the food, like you're drinking, you know, I mean, historically, people gain weight, right?
Right.
So we went on a cruise and we got back and we were really curious like how this cruise was going to affect our weight. So my wife lost 3 pounds.
Wow.
And I lost 2 pounds.
Wow.
Now, and the number of times that we went to the gym on the cruise?
0.
0. We're not watching our meals. Was drinking like the world was about to end. So like calories coming in, but we lost weight. Now, obviously, you guys probably know how we lost weight, right? Because
the stairs.
Because we were walking.
The steps.
Yeah. So the cool thing about this cruise, I guess it's cool and maybe in a way not cool, is that this was a cruise that had a stop every single day.
Yeah.
And we were in towns in Europe. The cruise was through the Mediterranean. We started in Barcelona, did Ibiza, Mallorca, Naples, Rome, Florence, Cannes, France. And so at each stop, we were like, well, we've got to see all these places, right? I mean, how often are you in, Ibiza and Mallorca? So we were doing like walking through the cities. We were doing up and down the stairs, at the Colosseum in Rome, walking through the Vatican. I actually have my little Apple Watch on.
Nice.
And we were, taking kind of a track of like how many steps and how far we're walking. And we did walk quite a bit. In fact, our biggest day was Rome. We actually did 18,000 steps, which is like 8.5 miles or something crazy like that. And so, of course, that was our biggest day. And a lot of days we did maybe 8,000, 10,000 steps. Well, normally when we're home, we don't take that many steps in a day. I mean, just because of the way America is, where you drive everywhere and you basically drive right up to where you're going to go to work and you walk in and maybe you get some steps, but you're not getting the crazy amount of steps that we did. And so that's just, the baseline of how we end up losing weight, even though we were consuming like enormous amounts of calories. Because when you're on one of these cruises, you're gonna get like the good dinner, you're gonna have like drinks through the day and at night.
Yep.
And so even though our calorie intake was probably at least twice as much as we normally have when we're home, we end up overall losing weight. And I've done some segments on steps in the past about how effective they are at actually controlling weight. You know, everyone's like big on Ozempic and the carnivore diet. And those things obviously work. I mean, we've done tons of segments on Ozempic and how powerful it is for losing weight. But I mean, it is taking a medication. And you know, where walking or getting extra steps has these really big advantages is, for one, there's like zero barrier entry, right? You know, I mean, if you want to go do CrossFit or do some crazy workouts, you know, you may have to get a gym membership, or you got to sign up for a group. You got to like go drive somewhere to do it. You know, if you're taking Ozempic, you have to go see a doctor. With walking, you don't have to do any of those things. You can literally just implement that into your daily routine and start to see the benefits of it. Also, compared to other exercises, it's very, very low risk. You know, I, a few years ago, was training, doing, you know, daily, not daily, but multiple times weekly running, and I tore both my calf muscles. You know, I mean, stuff like that can happen if you're either doing, you know, weights or high intensity workouts, or even just like running. Like, the chance of injury is not insignificant. With walking, not so much. You have a very, very, very low risk of getting injured. So, you know, and it's one of those things where it's more or less you just kind of have to work it into your routine. You know, some of the easier ways people do that, you know, finding a walking buddy is good. You know, if you have like a family member that wants to potentially improve their health or maybe lose some weight, you just make a pack, and the two of you have to like hold each other accountable about, okay, 2 or 3 times a week we're going to get out and we're going to walk. If you have a pet, walking your pet. Pets love to be walked. My dogs love to go for walks. That's another easy way to implement walking. Some things that are, you know, easy but you don't think about. When you go to work, don't park at the front. Park at the very back of the parking lot. It makes a huge difference. When you get to your work, if you work on the 7th floor, don't take the elevator, take the stairs. All that stuff really does add up when you start to implement it into your daily routine. And I do think it's really helpful to have some sort of tracking device. I actually had a friend of mine, my office manager, was kind enough to gift me one of her like old Apple Watches. And I don't wear it all the time, but I do wear it when I'm, you know, either concerned about tracking my steps or when I'm working out. And it makes a huge difference. Like, it tracks everything, and I think having that data readily available to you makes it real. You know, if you're just like trying to calculate your steps based on, oh, okay, I walked really far in the parking lot today. I mean, it's really hard to do. But if you actually have that data where it's broken down into, okay, yesterday I took 6,000 steps, today I took 9,000, and how am I gonna, you know, make most days more like the 9,000 instead of 6,000, it does make it much easier to track and to do. And, you know, I mean, I guess there's a little bit of cost of, you know, buying some sort of Fitbit or Apple Watch, but, you know, I mean, it's not a huge amount. I mean, compared to like a gym membership or, you know, some other type of, you know, enrollment to something, or taking Ozempic, you know, the barrier to entry is not too much. And then, you know, people all often ask, okay, well, how many steps do I need to take? How much do I need to walk? And that's where it does get a little bit muddy. You know, there's been all kinds of recommendations. Forever, you know, the recommendation was to take 10,000 steps, which is more or less walking like 5 miles total completely within a day, which, you know, the average person may walk a couple or 3 miles. So you got to add another couple miles in there. So you need to do that by walking around your block or implementing those things, like I said, you know, being in the back of the parking lot. However, that 10,000 step threshold has been kind of brought into question a little bit lately. Now there's a lot of studies out there that says even taking as many as 7,000 steps has a tremendous improvement on both like your overall health and your ability to lose weight. So there's a lot of research out there to show that it works. I mean, this is just not something people say to like torture you into like walking. There's been hundreds of studies in the past, you know, 10, 20 years that show that, you know, even like low pace walking is very effective. If you're able to do some more brisk walking, maybe it's shorter intervals throughout the week, then it also has a very equal effect. So I'm really big on this. You know, obviously as a physician, I want people to be very healthy. But, you know, like going to the gym is hard. I get that. I used to be a person that went to the gym a lot. Now that I work all the time and I have kids, going to the gym is difficult. But walking, it's not so much. I mean, and again, you don't necessarily have to set aside an hour a day to go walk 5 miles around your neighborhood. You can implement things like, one thing that people always talk about is like if you're on the phone, walk instead of just standing there. Like if you're talking to somebody, if you have a mobile phone, walk around, take the stairs, walk in the parking lot from the back instead of parking in the front. It's pretty easy to do and actually can have a pretty big impact on your overall health and your weight, as was seen by us losing weight on a cruise. So, all right, Brent, let me recap that real quick, and then we're going to try to roll into this AMA. So today we were talking about the benefits of walking for weight loss, and this was brought up by my experience of just coming off vacation and being on an 8-day cruise and eating and drinking like crazy, but ended up losing weight on the cruise. And I hit the gym 0 times on the boat, but what I did do is I walked a ton. We had several stops throughout the course of the cruise. We were walking throughout these towns in Europe, up and down stairs, and our step count was dramatically higher than it was when we were here back in the United States, and therefore we ended up losing weight even though we were eating and drinking a lot on a cruise, which we tend to gain weight. And so we were just kind of going over the important factors of how extra steps in your day can be very impactful to your health and help you lose weight. So if you want to check that out, go and look at the full episode. So, all right, now we're going to do the experimental part of this. And we are going to do a live Q&A. Ask me anything. So how many people we got watching now? Does it even say?
It's somewhere, but I don't know where. So I hate to say I'm a TikTok, yeah.
All right, so TikTok, we're leaving it up to you. We want you to come with your questions about anything plastic surgery, health, beauty related. We used to do this in the past on TikTok and it was pretty successful. So we were going to try that today to see if we could get the world of TikTok to jump in to any burning questions. And so sometimes people would ask questions about specific surgeries or things they see on social media. You do see a lot of like crazy stuff on social media. In fact, the show that we do here oftentimes is pulling up interesting stories about things that I find scrolling through social media. In fact, we were talking just a week or 2 ago about some influencer singer from Brazil that was going to Turkey to get plastic surgery, and she ended up partying with her surgeon all night the night before and then having surgery early the next morning, and she ended up dying. And we were talking about how crazy that whole story was, that the surgeon would actually go out and party with this patient and then take her to surgery the next day. And then we also were talking about the dangers of medical tourism. That's a really kind of big thing that has become popular in the past, decade or 2, which I'm really against that.
Bye.
Medical tourism poses a lot of problems, mostly with the doctor-patient relationship. Like there's language barriers. One of the biggest things that I see when people go do medical tourism outside of the United States is that you typically don't have complications right at the time of surgery. Most of the time these complications occur like once you get home. And that's where the big problem is because people will go have surgery and then everything will be fine for a day or 2, and then they will come home and start to have complications and they can't get back to their surgeon because they're in a different country. And so, as a surgeon that still takes emergency call, I do see these patients like all the time where I'll get calls from the emergency room that somebody had surgery outside of the country and now they're having a problem and they can't get a hold of their surgeon. And so, a lot of times these patients will have difficulty finding someone who is actually willing to take the case, because a lot of surgeons don't want to deal with other people's complications, and therefore these patients end up in an emergency room, and sometimes those emergency rooms have people that do plastic surgery and sometimes they don't. In this case, that the problem for this girl was even worse in that something really bad happened in her surgery, and she ended up dying. And one of the things that we postulated is that she got a Brazilian butt lift, and I talk about Brazilian butt lifts on this show literally all the time because I hate them. I mean, you see them on Instagram, you see them on TikTok, and the Brazilian butt lifts can look amazing in the immediate befores and afters, but you never hear about a lot of the downsides to them. And one of my biggest problems with Brazilian butt lift in general is that compared to other plastic surgeries, the risk of death is insanely high, anywhere from 100 to 1,000 times higher. And the reason for that is that it's just kind of the base of that surgery and what you're doing. You're basically harvesting fat from one area of the body and you're injecting fat into the butt. And the problem is if fat gets into your bloodstream, it is a life-threatening problem. And because the buttocks is a larger area as opposed to the breast or the face, which is where other people will do fat grafting, there's a bigger risk of that fat that you're injecting getting into the bloodstream. And then when that happens, it causes a catastrophic series of problems, and you can end up in a very bad situation. And a lot of these times when we're doing these news articles on people that die during plastic surgery, it's strictly because they were having Brazilian butt lifts. In fact, we were doing a segment a few weeks ago about Miami and the number of people that have died in Miami-Dade County from plastic surgery. And I want to say, if I remember correctly, that it was in a 3-year period, they've had somewhere around 30 or maybe 35 deaths due to plastic surgery, which is an insanely high number. I pulled some data on both Dallas and Los Angeles, which are also very big hotspots for plastic surgery. Not quite as big as Miami, but very close. And I couldn't find any stories about deaths of people in those areas. And so it does bring up the question of why does Miami have this really high death rate compared to other cities? I think that there's 2 reasons for that. One, there are an extreme amount of Brazilian butt lifts which are done in Miami, and those are very, very high risk of death surgeries. And also 2, in Miami, the regulation of who can do what is very, very loose. For example, if you look at some of these, plastic surgery mills, as I like to call them, and what I mean by plastic surgery mill is that's a place where you're not going to see a doctor, you're going to Lifestyle Plastic Surgery Miami or whatever, I just made up that name, and they basically assign you a doctor. Well, you don't really know what the qualifications or the training are for that surgeon. And if you kind of dig into these people, and they don't make it easy to look at, but if you dig in, then you will oftentimes find that these doctors are not necessarily plastic surgeons. They will be something like a oral surgeon, like a dental surgeon, or sometimes it'll be just a OBGYN. And you don't get the training to do these major aesthetic and plastic surgery procedures when you're trained not in plastic surgery. And it's kind of shady, honestly. I mean, this happens all over the country, but it does seem to happen a lot more in Miami and Florida, because the laws are very loose on what a doctor can do to you in their own office. And so that's why when you see these facilities, the surgeries are always done in the office. They're not done at a real hospital or a real surgery center. Why is that? Well, because hospitals and surgery centers actually have criteria for who can do what. And if you're doing something in your office, then those regulations don't exist. So yeah, it's kind of a problem. I talk about it on the show all the time, mostly just to make people aware of what's out there and what to avoid. So Rob, we got anything in the TikTok sphere?
Yeah, so...
You can stop me too, by the way. If
not as many questions, that's why, yeah. But what's the most asked question by all of your patients? Let's go men. You mentioned having a lot of men coming in the office.
It is more, so yeah,
right.
I mean, men.
So
okay, good.
If you picked one question, I mean, they're going to ask you several questions, but what are they asking? For maybe a couple of those questions.
Yeah, so just a couple things on that. Like, it's interesting. Women do dominate plastic surgery right now and have historically. It's about 9-to-1, meaning if you have 10 patients getting plastic surgery, 9 will be women, 1 will be a man. But every single year, the number of men that are asking about plastic surgery is going up. And, there's a lot of reasons for that. I mean, plastic surgery is becoming less taboo. People talk about it more often. And so you're going to see more men be interested in it because they're hearing about it more. But also some of the things too is, ageism has been a thing in the news for the past 10 years, meaning, men in the workforce are, not getting positions because they look old. And there was a big lawsuit with Google about that, where a bunch of men sued Google and won because they felt like they were discriminated on because of their age. So you got men that are asking for things now, and those could be minor things like Botox is starting to become popular in men. Non-surgical skin tightening stuff. In fact, I do that myself. I have a full med spa in my surgery practice, and we have some really good lasers and really good microneedling machines, which are great for tightening skin. And you think of it as a non-surgical facelift or lift of whatever skin you have that's loose. And these machines are very effective. And so yeah, I use one every year. I mean, I'm 50 years old. Most people probably wouldn't suspect that. And some of that is due to the fact I do have pretty good genetics. My parents always look kind of young, but it doesn't hurt that I am using these machines to do skin tightening. So we get men asking for that, but one of the most popular things that I get asked for by men is gynecomastia surgery. Man boobs, right? Man boobs are a thing. They exist. Historically people wouldn't necessarily seek out to try to fix them, but they actually are pretty easy to correct. And it is surgery, but it's not like a super major surgery, something like, a mommy makeover, right? If you're doing a mommy makeover, you're doing abdominoplasty or tummy tuck along with some breast surgery. Yeah, it's a pretty big surgery. It's gonna keep you down for a while and you gotta take a lot of time off work. But, if you have gynecomastia, that's more of a minor thing. You can come in and you can have it, you can go back to work pretty quick, and the results are really, really good. So, yeah, we got men asking. The other thing too is the Ozempic effect. You hear Ozempic in the news all the time. Ozempic is insanely powerful for losing weight, and it's very effective at people losing large amounts of weight. Well, what happens when you lose a large amount of weight? You get loose skin. So I've actually gotten quite a few men coming in asking about tummy tucks in the past year or so, and I'd say probably almost every single one of them had a significant weight loss, which is why they have the loose skin. And one of the kind of biggest methods for how these men are losing the weight is through Ozempic. So again, yeah, men seeking plastic surgery is a thing. It's getting a little bit busier every single year, but still, women do dominate the plastic surgery field. I mean, it's, I feel bad for women. Society really kind of holds them, I think, to a higher aesthetic standard than they do men. Which is not right, but it just kind of is what it is. And so, at least for now, women are kind of dominating the plastic surgery sphere. So, anything else in the TikTok sphere? No, TikTok is quiet today, man. Oh, that's pretty shocking.
Could be me, could be the settings, who knows? I'm playing with it, we'll see. So what, right, I guess y'all kind of have seasons. What's happening right now? You've got summer coming down.
Yeah,
so
that's a good question.
Everybody's going back to school.
The seasons of plastic surgery. So, that's been an interesting phenomenon that I've noticed that does actually hold true year to year is when people are getting plastic surgery. So summer historically is the absolute slowest time of the year. Now, at this point in my career, I've been in practice 15 years, and I stay pretty busy pretty much all the time. Of course, when you're first starting out, the seasons of plastic surgery hit you much harder when you're not quite as busy. But it still does hold true. So I would say that the absolute busiest time of the year for me is around October to December. That kind of end of the year time, we get tons of people having consults, tons of people that are wanting to have plastic surgery. Typically, it kind of dies off after the end of the year. However, at this point in my career, we get so many people coming in for consults at the end of the year that we have overflow into January and February. And so we will still be pretty busy in January. Then we see a little bit of a dip in February, but then we get another spike in the spring as people are getting ready for summer. And so we'll get people that are wanting to get ready for their beach body or the lake body or whatever. So we get people wanting, breast surgery, tummy tucks, and lipo, and all those sorts of things. And then it kind of dies off in the summer, especially here in Texas. People don't want to have surgery in the summer and have to wear compression garments or special things. People are traveling, so we see a little bit of a dip in business in the summer. But again, at this point in my career, we're kind of busy all the time. So
It's coming up. Your busy season's coming up.
yeah, busy season is coming up. In fact, we had like one open OR day this month left as of Tuesday, which is great, because again, this is our slow time of the year. September is filling up pretty quick, which is nice because we're not really into our busy season. We will see like a deluge of people coming in like once kids go back to school. Because most of our, the biggest bulk of our practice at this point is women who are done having kids. That's the most common people we see, because they need things like tummy tucks, breast lifts, breast augmentations. And so once the kids go back to school and things are kind of like slowing down for them, because if you have young kids, like summer's kind of busy, like you're traveling, the kids are at home, you're taking them here and there. Once they get into school, things get a little bit calmer. We'll start to see more consults, and then we'll get really busy. But again, I'm kind of lucky at this point, and I've been doing this a long time now, so like we don't have like the really slow season like that we did when I was a younger surgeon, where we had times where it was like, geez, what am I doing? But I still do other stuff too. I mean, I don't just do the cosmetics, I still do trauma. In fact, while we were setting up, I got a trauma consult that I'm gonna have to go back and see like later this afternoon. And I do the reconstruction stuff. So yeah, I haven't quite gone to like the full cosmetic.
So is now a good time for people to think about getting the lasers and the hair removal?
That's a great question.
Everybody wants to do it before bikini season.
So oddly enough, like summer is not the best time to pursue a lot of like high intensity skin treatments, because the sun itself is a negative effect to those. And especially things like broadband light therapy or intense pulse light, like if you get a lot of sun exposure before or after that, it can actually burn you. And so we encourage people not to do things like IPL, intense pulse light, in the summer. You want to do those like fall, winter, early spring. Lasers are a little bit different. Like I'll do a laser on myself in the summer if it's just the time that I want to do it. But you just got to be super careful about sun exposure afterwards.
That's actually interesting. I never thought about that, but that's actually a good point.
Yeah.
How much you're in the sun and how much damage it can do. So.
Now, Brittany, you're pretty young. You haven't done anything like that, have you?
No.
Yeah. Do you mind asking how old you are? I know you've told me.
I'm 22.
Oh, yeah.
23 coming up.
Yeah. Okay, so you're way early. So yeah, definitely you don't need to like jump into that field.
Yeah, pretty much almost all my closest friends have had lip filler or lip flip.
Oh, lip filler,
and
yeah.
I've never like considered it. There's been like times I'm like,
you have
like,
good lips.
Thank you.
You don't need it. Like some people need it. Like there's people out there that have like really, really thin lips, and so, I'm not saying they need it, but like it would.
It's an insecurity that a lot of people have.
Yeah, some people either have an insecurity about it, or they just want to, maximize their potential or whatever. And so, I don't have a problem with, younger people doing stuff like that if it's something that will make them happy and they're conservative. I hate when people go overboard. Do you have friends that?
Oh yeah.
Do you have friends that have gone overboard with it?
Like blind to it. Almost.
Right, I know.
So here's my question for you.
Okay.
Do you tell your friends, not you, Bruce, but do you tell your friends?
Do you tell your friends like it's time to tap the brakes?
Yeah. So.
Not anyone like. I know someone that I used to work with, and I've never told her because she likes it. Like she wants it to be dramatic. It's like watching Love Island. Like there's so many of those memes of certain people that like the top lip is like, I don't know, they compare him to like a cartoon character, like a duck or something.
Right, yeah.
But yeah, like one of my best friends has an underbite, and so she wanted to get lip filler on her top lip because she already has big lips, but That's
Oh,
why
to
she
even
got
it
on
out?
top. Yeah.
Did it work?
So I'm like, yeah, it did.
Oh, nice. Okay.
She's getting it for free. It's one of her mom's friends that is doing it for free for her. So, yeah, and she was like, I want to get more, and I'm like, you don't need more. Like, your lips look great right now. Like, I wouldn't go anymore. So I told her that, but.
I think like if I had a friend that was like kind of going overboard, and I do this with patients, like because I've had patients that I've done lip filler on, and because to me like the best procedure, no matter what it is the one that nobody knows you've had. Like you get the procedure, and you look great, but you don't look like you've had anything done. And I think that is really kind of the sweet spot or the secret of doing these things. And so, I've had patients come in, they're like, I want to get some lip filler. I'm like, okay, cool. Like, I think that it's appropriate for you at this, point where you're at. And I'll do some, and I'm like, man, this just looks beautiful. And then they'll come back, and they'll be like, I want more. And I'm like, ooh, really? You want to do more? It looks so good. It's like if you painted a picture for somebody and you gave it to them, like, yeah, this is great, but I want more on the painting. And you get to a point where it becomes too much, and we've talked about that on the show, but tons of times where it's like you just get to that tipping point where it goes from, man, this looks great, to this looks fake, to this looks fake and it looks bad. So yeah, that's why I encourage people when they're considering lip filler is the biggest one. The cheek filler is the other one. When people get too much cheek filler, like Madonna fell into that trap. A year or two ago, we were doing segments on her. I mean, she looked like an alien from like Area 51. Oh, no. Because like she's got that pointy chin and she had these huge cheeks, and I was like, oh my God, what happened to her? But yeah, I do think that that's kind of the secret with doing like the filler stuff. You just want to kind of find that sweet spot of I look good, but I don't look overdone. And the problem is a lot of these people that do fillers, they're pushing stuff, they're pushing product on you. The more product that they use, the more money they make. And so, it's not necessarily in their benefit to tell you no. For me, like, the med spa stuff is just a side. I mean, our med spa is actually pretty busy, but like the surgery practice for me is like my main gig. And so I have no problem telling people no, or telling people I don't recommend this, even if it costs me money. And I do that even in my surgery practice. We had a couple consults, was today Wednesday? Yeah, no, today's Thursday. On Tuesday, where people wanted like multiple surgeries, like, no, you only need one surgery. Like, you don't need to do two. And I think people like that. If I'm willing to tell people, hey, this is what I think you need, but it actually is less money, then people are, you're generally pretty responsive to
it. Yeah, I think that's the tough part about medicine is, what's in it for them or anybody, your car insurance or buying a car.
And I think that's one of the reasons I think plastic surgery gets such a bad rap is you get a lot of like bad actors, it's saturated, right? There's a lot of people out there trying to push either surgical procedures or med spa procedures, and it's kind of cutthroat, and they're like over pushing stuff when the patient doesn't really need it. And again, that's kind of why I do these these podcasts and do these videos, is try to educate people so that if you're going to make the plunge and doing X, Y, or Z, that you know what's out there, and the information that is going to help you make smart decisions.
So in some of these procedures, just, I know it all depends on the patient and whatnot. So let's say I'm getting filler, or...
You want some filler, Rob? I'll hook you up.
I mean, no, I know you will. I probably need some, but just in general, so if I'm getting the lips done or, some of the filler on the face or whatever, what's kind of like the timeline there? And then I'm going to ask about some others too.
Like how often do you do it, or when do you start it?
Yes. Well, when you started, I know is now, but...
Well, I mean, not necessarily.
What's the timeline of like, okay, tomorrow it's going to look good the way I want it to?
Oh, gotcha, yeah.
Whatnot.
So that kind of depends on what you're talking about, So I'll pick some like really common things that we do, and I'll go over when you start them, how often you do them, and when you see the results. And maybe that'll answer your question. So let's start with the simple one, like Botox. I don't have a problem with people starting Botox in their late 20s. So Brenna, you're too young. Don't go get Botox yet. But
Dang it.
yeah, you don't need it. You look great. But
the only thing I've considered is maybe like I think I have a deviated septum. Like I've had nose bleeds growing up.
Okay, well that's more reconstructive stuff.
Yeah,
so that's different. But yeah, as far as the Botox goes, I don't think you necessarily want to wait until you're 50 either, because I always use my wife as an example. I'm sure she probably hates that. My wife started getting Botox in her early 30s when I kind of got into the plastic surgery, that pathway, and now my wife's 50 and she has no wrinkles. She has no wrinkles on her forehead, none around her eyes, none between her eyes. Why is that? Well, she's been using Botox, and those wrinkles which would have formed never did because the muscles couldn't make those contractions. And so because of that, I do think using Botox preventively is a reasonable idea if you're really serious about wanting to stay looking as young as you possibly can. So I think, late 20s is kind of the early starting point for that. Botox you're going to want to do every 4 to 6 months, just depending on how your body kind of processes it out. But like 6 months is kind of the longest that it'll go. And then as far as how quickly you see the results, Botox takes about 3 or 4 days to start working. So you compare that to something like filler, right? Okay, so when should you use filler? Well, it kind of depends on what you're using it for. If you're using it for your lips, you could do filler at 18 or 20 if you felt like you had a thin lip and you wanted to, increase the volume a bit, and that would be totally reasonable. Now, if you're using filler to mask aging, then it just kind of depends on when those aging lines here or here start to pop up. Same thing with using cheek filler, like when people want to plump up their cheeks. Again, when does the mid-face start to hollow out? And that could be from age or weight loss, and there's a lot of reasons. So using filler like for the aging type things, you don't see people start doing that until probably their mid to late 30s or even early 40s. Sometimes you can get exceptions to that if people have had weight gain, weight loss, which will age you prematurely. Filler is pretty effective right off the bat. Typically with filler, you get it and the results are there and you can see them, pretty much immediately. And then, the other one that's really popular in the med spa industry is like lasers and microneedling, which I do that myself. It's the only treatment so far that I have been doing myself within the med spa, though my office people are hounding me to start using Botox, but I haven't done that yet. But yeah, I love the lasers. They're pretty easy to do, minimally invasive, low risk, and the results are pretty nice. You can get some really decent skin tightening, and so these are something I wouldn't necessarily recommend to somebody that's 80 years old. At that point, the horse is kind of out of the barn already, and you're probably going to really need to lean more into like the surgery realm. But for people that are like, late 30s, early 40s, late 40s, early 50s, these treatments can be insanely effective to turn back the clock. So that's kind of like the age frame for using those. We do get people that are even in their younger 30s using them more for like preventative, just to get like rid of like large pores or just improve like skin blemishes, which can happen even when you're young. So there's a little bit of variability in age on that. Like with those treatments, a lot of times it's a series of treatments, and then basically you're seeing the full effect like 6 weeks after your last treatment. So yeah, it's kind of a big question that you dredged up there, Rob. But it's a lot of good information, as far as like what is there out there, and when should you start it, and when do you see your results, and of course there's all kinds of other things out there. Those are kind of my big ones, Botox, filler, skin treatments. That's the majority of what our med spa does.
Yeah. What about breast augmentation? Like,
when to do it?
Well, when to do it? Yeah, never a good time, but always a good time. But like, what's the recovery time on that? Does it take a whole month? Do I need to take all this work off?
Yeah, in general, breast surgery across the board is pretty easy, with the only exception being like if you go get botched somewhere and you have to do some sort of major plastic reconstructive surgery to fix it. But like run-of-the-mill breast augmentation, or even like breast lift, or even, within reason, breast reductions, typically are a pretty easy surgery. My kind of go-to time frame for what I tell people to take off work is a week, but that's a really conservative answer. I've had plenty of people that I personally know that I've done surgery on, and they have done a surgery on one day and be back to work in 2 or 3 days. And that goes for, like I said, breast aug, breast lift, even, you know, breast reductions if they're not huge ones. In general, breast surgery is not a really painful procedure because at the end of the day, the breast is made of skin and fat. And when you operate on skin and fat, the recovery is just not there versus if you're doing like muscle or bone surgeries. Like if you get a shoulder replacement, I mean, you're knocked out for like 4 to 6 months. You know, you do breast surgery, it's just a completely different ballgame. You know, the one surgery we do very commonly where there actually is a, you know, moderate amount of recovery is tummy tucks. And it's, you know, it goes back to the same reason. You know, the tummy tuck, you are operating on skin and fat, but you're also tightening up those muscles of the abdomen and tightening them together where they've gotten stretched out from pregnancy or weight gain and weight loss. And that's why those surgeries have a little bit more recovery, but they're still not bad. I mean, there's some medications that have come out like in the past, you know, 5 to 10 years, which really help. Exparel is the one I use. It's a long-lasting local anesthetic, and I inject it all into the abdominal wall, and that's really made a big difference. So, you know, I tell my tummy tuck patients like 2 weeks is probably reasonable to take off work, which, you know, is a lot longer than 2 or 3 days for like a breast aug, but still not, you know, the months-long surgery recovery that you'll see with you know, like major orthopedic surgery or something like that.
So kind of a random question that came in. How many tummy tucks have you done? I mean, I know like that's hard to count, but.
No, I actually kind of keep track of that. You know, I've done in my total career, including training and since I've been out, I would say 600 to 700. You know, that's a lot. Like, there's not a lot of surgeons that have done that many, I would say. I mean, because I average probably about 1 a week, you know, and I've been doing this for 15 years. And so, yeah, it's quite a bit. I've done more breast surgery because you get more types of breast surgery. Like, you get, like Monday I did, what did I do Monday? I did a breast lift, I know for sure, and then I did a breast reduction, which is like a breast lift. So, you know, I did 2 breast surgeries because they're quicker. You know, a lot of times you're doing a tummy tuck, it's a mommy makeover, it's full day surgery, and you know, I mean, some weeks I've done as many as 3 tummy tucks in a week. I don't know if I have one this week. I think I have all breast surgeries this week, but then we'll probably have, you know, a tummy tuck or 2 next week. But yeah, probably 600 to 700.
How many breast surgeries then?
Thousands. You know, you're
probably not kept up with that, have you? So
it's just hard. I know I do 300 to 400 surgeries a year, and I've been in practice 15 years. So what's that? So that's like 6,000 surgeries.
So you've done, just so we're clear, 6,000 approximately breast surgeries.
I don't know if I've done 6,000 breast surgeries. 'Cause I would say I've probably done 6,000 surgeries since I started my practice.
Wow.
You know, so breast surgeries were, you know, in the multiple thousands because I've done breast reconstruction, I've done breast augs, I've done breast lifts, I've done breast reductions. And so those numbers start to really pile up. You know, my whole focus of my practice is breast and body. So compared to like the average plastic surgeon, my numbers are going to be much, much higher in the realm of like tummy tuck, lipo. You know, probably the number 1 surgery I do is lipo, only because it's combined with so many surgeries.
Right.
You know, I do lipo when I do tummy tucks. I do lipo when I do gynecomastia repair. I do lipo when I do arm lifts. I do lipo when I do thigh lifts. And that's why that when we do that yearly review of plastic surgery, when we talk about which procedures are done the most, lipo is generally number 1. Like, augmentation is right there with it. And in previous years, it's kind of flip-flop back and forth. But lately it's been lipo has been number 1. I think that's because you're seeing a very slight decline in people looking for augs, and the demand for lipo is still pretty high. Because again, it's not number 1 because those patients are just having lipo. It's like they're doing lipo with a tummy tuck, or they're doing lipo when they get a breast reduction or whatever. So, but yeah, I've done a lot. I do a lot of surgery, and
yeah, you've seen a lot of variety. Different
yeah, at this
things.
point, I'm like the old guy.
What is a couple of ones that maybe stick out that happened that, you know, you can share or whatnot? You know, really quick or
pertaining
really
to
fast? Just a surgery or a reconstruction?
You know, people ask me that question a lot, and I do go to like one particular case, which was really, really cool, and it wasn't a cosmetic procedure, it was a reconstructive surgery. I got asked the first year I was in practice to see a patient pro bono, which means, would you see a patient for free? And I was like, yeah, sure, like, you know, I do pro bono work all the time. I mean, it just kind of pops up. So there was a young girl who had immigrated with her family from Egypt. And when she was really little, like 6, 8 years old, she was in some pretty bad accident where she had these really bad burns on one leg. And when I say bad burns, like this is like Frankenstein looking scars, man. Like this is like, wow. You know, I mean, not just like, hey, what's on your leg? It's like, whoa, what's on your leg? And they were really big, and they were like, what can you do for this? And, you know, something like that can be challenging and basically impossible to get rid of in one surgery, but you can tackle that in multiple surgeries. So I said, look, here's what I can do for you. I'm happy to see you. I mean, of course, I'm talking to her dad, because at the time she was, I think, 12 when I finally saw her for the first time. I was like, I can tackle this, but it's gonna be a stage thing. We're gonna do one surgery a year until we get rid of this. And so one of the first things I did is put tissue expanders around her normal skin that was around this burn, and I stretched out her skin, like made it much bigger than it should have been. And what that allowed me to do is then I took her back like a month or two later after the expander had been filled up, cut out a lot of the burn, and then pulled that stretched skin over it to cover the part that I pulled out. Wow. And so the first year I did the expanders and I tackled a big, huge part of it. The next year, after the skin that I laid down had kind of reset and softened up and stretched a bit, then I would just segment out some of the scar and I'd pull the skin in. And I think I ended up doing 4 or 5, I think maybe 5 total surgeries over the span of 5 years. So from the time that she was like 12 to like 17. And I ended up getting rid of the absolute entirety of that scar, which was like from like her mid lower leg to like her upper thigh, and covering, you know, not quite circumferentially, it was probably half of the circumference of her thigh, and made it go into, all that was left was a tiny laser beam. That was it. That was a tiny laser beam scar that was basically unnoticeable. Wow. And so, in fact, like the local paper wrote an article about it, which was kind of cool. I don't know what happened to her. I did her last surgery probably 10 years ago. Yeah. So like to me that was the coolest, because like her family and her were like so, you know, thankful for that. And I basically, because somebody in the hospital asked me to do it, the hospital donated the OR time. So it basically cost the family nothing, because I didn't charge them anything and the hospital covered their end. And you know, that's definitely, when people ask me what was kind of the coolest thing you ever did, that always pops in mind. I mean, I've done lots of cool stuff, you know, saving people from necrotizing fasciitis, flesh-eating bacteria. I've had a couple of those. Treating cool snake bites, and they're not cool, but they're like crazy. Yeah, I've seen a lot of stuff. You know, still do trauma. Trauma's always interesting. People do all sorts of crazy stuff and end up in the trauma room. But
yeah, well, you get called because of the hand things, right? And so
yeah, I do hand and reconstructive trauma. I don't do general trauma anymore. So like somebody gets shot like in the chest, like that's not going to be me. But if you get shot in the hand, that would be me. Or if like you're in like a motorcycle crash and you rip all your skin off, that would be me. So yeah, I still do the trauma stuff, which is interesting. It just makes my practice kind of varied. I mean, it'd get kind of boring just to do breasts and lipo all day. I mean, it's good for the pocketbook, but
absolutely. So. You know, what I notice is a lot of searches on plastic surgery are about safety and efficacy, or, you know, for the layman, how well do they work, you know, that sort of thing.
Yeah.
So I guess with safety, what are your top two tips besides staying in the United States and not traveling and all that silliness, but...
Yeah, I mean, I think the biggest way to ensure your safety is to make sure that the person doing the surgery has been trained properly and is qualified. Because I will tell you, in the United States, there is a massive problem with non-plastic surgeons posing as plastic surgeons. And I know that sounds crazy, but it happens literally all the time. In fact, I do a lot of medical malpractice consulting, and there was a big case that we're doing where a patient was convinced that they were seeing a plastic surgeon and they were seeing a dentist. So finding a board-certified plastic surgeon, there's only one board that counts, literally only one. It's the American Board of Plastic Surgery, but there are tons of fake boards out there. So find the surgeon that's qualified, that's really a plastic surgeon, that's really board-certified. I think that is absolutely the number one factor for being safe. All right, Rob, you got a couple questions?
Great question. Right here that Brittany McKinney asked.
Hi, Brittany.
What's your favorite procedure to perform?
I like doing tummy tucks because they're so dramatic. But I also like doing like the augmentation lifts because they're very artistic. So those are probably my two favorites.
So
I've just done millions of...
Dramatic, what do you mean? Like all of this stuff and it
yeah,
takes
so
a long
like,
time?
I mean,
or you see the biggest difference?
You see the biggest difference, because I mean, when you do breast surgery, I mean, not everyone's seeing that. I mean, yeah, they look good in clothes, but like a lot of people like wear swimsuits and stuff, or want to wear stuff like shorts, and they can't because they got overhanging skin, or the belly's really kind of pooched out because of pregnancy. So like the tummy tucks give really, really dramatic results. Sometimes the breast surgery does as well. But yeah, those are probably my favorite. I mean, it's the bread and butter of what I do. It's like breast and tummy. I mean, and plus I've done so many of those that, like when you get really good at something, you really like doing it because you're doing a good job, and people are coming to you because of your expertise, and so it's kind of like a pride thing too. So
I'll tell you who asked it after, but what's the number one skincare recommendation that your nurse would recommend? And that was asked by Maddie Trujillo.
I'm going to tell you that probably the absolute most important thing to do if you want to keep your skin looking youthful is to wear sunscreen and just not get too much sun exposure. When I get consults in the office, I can 100% tell who's spent their life in the sun and not used sunblock. I can literally see it on their skin. The effects of the skin are there when you're trying to do surgery. So, I mean, absolute most important thing, UV light protection, whether that be sun or not using tanning beds. After that, like good moisturizers, moisturizing your skin is super, super important to keeping it healthy. And then the other thing is using good cleansers to get off like dirt and oil.
So like
bread and butter stuff.
What's a product or like a line?
Skin Better.
You send a guy like me into the drugstore or wherever.
I have some good stuff for you, Rob. If you want.
I'm sure. So what?
I use the Skin Better for men.
Okay.
I've actually started using it. Historically, and I know the girls' moms hate when I say this, historically I was not really great about skincare stuff. But I've started to become a little bit more in tune with it. Not always, since I've become an adult, I have used sunblock pretty regularly. Did not do that when I was young, which is probably bad. My skin's pretty good, but I definitely took some damage when I was young. But again, sunblock's important. But I've started using a good moisturizer. There's a Skin Better for men. I can hook you up with some.
Sweet.
If you want to try it.
Well, yeah, I'm all about it because
I'll bring you some stuff too, Bennett.
Absolutely.
If you want some product,
hindsight's always 20/20. We get older and we're like, oh no, what do I do now?
Yeah, right.
But that maintenance.
Yeah, I mean, skincare is definitely an ounce of prevention is worth a pound of cure. I just can't stress enough the sunblock. Like, sun is super bad. The other thing is that's not as popular anymore is smoking. Smoking is really bad for your skin as well. So don't start smoking, kids.
Yeah. And vapes too, don't do that. That burns
that's bad for, I don't know if the vapes is bad for your skin, but it's probably not good for you.
I'll talk you out of that one. I used to call on dermatologists and they were like, people not wearing sunscreen keeps me in business, but I really suggest it. When I was little, it's along the same lines. There was a dentist on our block and for Halloween, we got toothbrushes.
I'm going to give out sunblock at our house for Halloween.
So exactly, that's what you need to do. So also from Maddie, she wants to know how much you love your staff.
I got that same one on Facebook.
Hey, I'm
from Morgan.
I'm gonna be honest. Like, we have an awesome set of staff right now. Truly, and I'm not just saying that because. I'm the boss, so I can say whatever I want. But we do have good staff right now. It's like a great crew, and I hope they all stick around because we haven't always had a great staff.
Along those lines, I saw a question on the Facebook, not here, it was random Facebook in the town I live in, hey, my Botox person is going up to $600 or whatever, blah, blah, blah. So do y'all have any recommendations? And they're just throwing it out there for the universe to recommend.
Yeah.
And I wanted to tell her, like, hey, like, this isn't a Facebook question, by the way. Don't go by cost. You get what you pay for. But like, what would be the difference? Because it seems like every corner has a med spa or whatever.
I mean, so one of the dangers that you can fall into with med spas is like, who is overseeing it? Because there's not a lot of regulation in who's the overseer of the person doing the procedure. And that's why I have a little bit of fear with some of these pop-up med spas that have like a family practice doctor as their medical director. What does a family practice doctor know about aesthetics and things in that field? Nothing. They don't know anything. And so what does that mean? Well, that means that they're just the director in name only. So I think that if you're going to go get med spa type treatments, I think it is very important to know who the medical director is, because if it's not somebody that's been trained in aesthetics, so like plastic surgeons and dermatologists make fantastic med spa directors because they actually know about the stuff that's being done, versus if you go to a med spa where it's staffed by a medical director that's an anesthesiologist, which there was one in the news recently where someone died where that was the case. That person really has no input whatsoever into what the people there are doing, and so the people are just freelancing. And so that's one of the biggest things for safety, is making sure that whoever is doing your procedure actually has a good medical director, because if they don't, then it's sketchy. Like, you know, if somebody's popping up and like getting some random doctor to be their medical director, then they're basically acting on their own, even though legally they have like an overseer. So, all right.
I have a YouTube comment.
Okay, let's hear the YouTube. That'll probably be our last one. We got to wrap it up. But what do we got?
From Matt, he says, preventative Botox, 27-year-old male. I wear sunscreen, moisturizer, and have a healthy diet / lifestyle.
Yeah, so, I mean, that's a great question, Matt. You know, 27 is kind of like at the early point of when you might start using preventative Botox. I would say if you are dead set in not getting wrinkles here, or here, it's not unreasonable to start at 27. I typically say 30 is kind of that starting point. And the reason I say 30 is because it's very rare to see someone that's 30 that already has deep set lines. And so I think you're a little bit early, but not like out of the realm of reasonability. We do have people in their late 20s that come in and get Botox from us. Just keep in mind, it's going to be more preventative as opposed to the patient that's in their 50s or 60s, where the Botox is kind of curative to, you know, eliminate lines that are already there. So you're a little bit early, but it's kind of up to you at that point. I mean, I think for Brenda, she's way early. You're kind of a little early, but within reason. So. All right, well,
Hey, before we go,
yeah.
Sorry.
No problem.
So maybe, because it's medicine, and that was a great question to end on, but I want to ask a question, you don't call them out, or they're not on everywhere. Where's a good place to
So,
snail mail, whatever?
Probably the best place to ask questions would just be to pop the question on our Instagram, because I actually take a hand in running my own Instagram, but I have a team that runs it as well, and so if I miss a question, they'll bring it up to me. The YouTube videos, same thing, both the team and myself kind of review those comments.
So you're going to answer that, not some person?
Yeah, my staff, my people don't answer questions specific about procedures. They're not really supposed to do that.
Right.
So if the reply is like yeah or hey or thanks, then that could be my people. My replies are generally big. Like, it'll like be like, hey, thanks for your question, blah, 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 blah. I probably should start signing them at the end. But yeah, like that's probably the best thing. I'm gonna try to get on TikTok more, I think. I don't know. I get comments on TikTok all the time and I don't always answer them, but I need to be better about that. So, but all right, well, that was a lot of fun. I actually kind of enjoyed that. Bennett, thank you. Rob, thank you for joining in on this kind of interesting episode of Nip Talk. Thank you guys so much for tuning in. We really do appreciate it. Please leave a comment. We do try to answer them. If you have segments that you want us to do in the future, we'll be happy to do them. So have a good week, and we'll see you next time. Thanks.